Imagine you could step inside the minds of Canada's healthcare leaders, glimpse their greatest fears, strongest drivers, and what makes them tick. Welcome to Healthcare Changemakers, a podcast where we talk to leaders about the joys and challenges of driving change and working with partners to create the safest healthcare system.
Welcome to our second episode of HIROC's special podcast series, Rebuilding Primary Care. I'm Ellen Gardner with Philip D'Souza. We're delighted to partner with AFHTO, the Association of Family Health Teams of Ontario, to highlight the work of several amazing primary healthcare teams. These teams recently presented at AFHTO's virtual conference. Today we're speaking with Dr. Cleo Mavriplis, who has been a family physician and professor for 37 years. In 2017, Dr. Mavriplis started working with a small interdisciplinary team at the University of Ottawa on an app called icanbewell. The app launched this year and is the only Canadian, evidence-based, bilingual mobile application for preventive care. What's unique about the app is that it has a patient interface and a healthcare provider interface, and both are visible to each group. Healthcare providers can search by age and gender for options on applicable preventive measures for a particular patient, and they can also access teaching materials for patients. Patients can use the tool in a similar way to learn about self-assessment and general prevention guidelines. With information on a wide range of illnesses, including COVID-19, the app has empowered Canadians to take responsibility for their own preventive care. Cleo, I want to start by asking you what you do and where you work.
I've been practicing as a family physician for 37 years, and I've been teaching in medicine for most of that time. I'm very fortunate to work for two wonderful organizations. The first is the Briere Academic Family Health Team, and it is part of the University of Ottawa. And I have started my research there on this app, and I've been working on the app with University of Ottawa computer science students. The second organization I work with, because I have cut back my clinical duties since 2019 to devote more time to these passions that I've developed through my career. So the second organization is McGill University. So surprisingly, you might not know that McGill has a new satellite faculty of medicine across the river from Ottawa in the Outaouais, and it's in French. And my position is Assistant Dean of Faculty Development, so to help improve medical education there. So it all revolves around education, basically, and preventive care.
Why was the creation of the app necessary or important in your view?
So I've been teaching preventive care. So what are the guidelines to prevent disease? And there's 50 to 70% of all illness and disease in Canada and in the world they're really due to preventive causes. So wouldn't it be wonderful if we could prevent illness? We'll never get everything prevented, of course, but studies show that if you advise people and do some intensive training, that you can get about 30% of people you're talking to quit smoking, for example, or change their lifestyle. So for me, as I was teaching this, I was realizing there's so many different guidelines in so many different places, and we were summarizing them for the students. When I say we, these are two nurse practitioners and myself from Briere. And we published an article in 2016 in Canadian Family Physician, which was a summary of all the Canadian guidelines, because they're not the same as the American. And so readers of the article said to us, we need an app so it can be updated quickly, as opposed to publishing an article every 2 years. And second of all, they said, we really would like a tool to teach patients, where in their body we're talking about when we talk about colon cancer screening, for instance. So it kind of evolved out of all that.
I found it really interesting in your presentation to AFHTO, the conference, how you really went through some of the vignettes, and it looks like the vignettes are a crucial part of the app. Why is that an effective way of helping patients find preventive measures for their health?
So the vignettes are not actually on the app, but the thing is, if you enter the app, you can enter any age and gender combination. So then you can look through what would pop up for that. So it's more in explaining the app to people that I use the vignettes. And we use it, actually, we have a video that's right on the landing page. And in the video, we show 2 vignettes of patients who are curious about what they could do, for instance, to prevent heart disease, and a young woman who's worried about COVID. And the vignette I used at the AFHTO conference was a young woman with kids who loses her job and is interested in finding out more information. So I guess the shift now is to port more content so that people who are in marginalized populations can access information to help them stay healthy. So there's a tool there that they can use, and if we direct them there and make it user-friendly, they could take prevention into their own hands and start changing their behaviors and to really improve their health. So for me, it's an important tool, and for providers too. A lot of providers don't have the time to go through guidelines that are scattered all over different websites. So it's to bring it all together in one place.
It does seem that the app it's valuable for providers and working with patients, but is it easy for patients to use on their own?
So interestingly, in our study, we got a lot of feedback from patients, and the number one thing was they said it was really easy to use. So our programmers and our design and the way we present information is easy to use. What was really interesting, because this study was about a year ago, was that people are more used to Googling information about symptoms. And we found out they really go to American websites. And so when we did the interviews, they were like, oh, I didn't know that Canadian health information is different. And that's why the app is important. And it's trusted. I don't have to rely on Google. I can go to a place that has, sort of specific information that's been evaluated by healthcare professionals to be right. So they really liked that. And because they were sort of not sure about sort of symptoms versus preventive care, we created the video to put on the landing page to really clarify that this is to help you stay healthy. And preventive care, is kind of like the poor sister of curative or medicine, and it's neglected. So we're really trying to emphasize that.
Are you doing promotion so that, more people can know about it and use the app?
That's something I really want to do. It's been a sort of a labor of love, mostly myself, curating the content and the computer science students making the app. And we studied it before we wanted to really launch it out into the universe. So yes, now would be the time to do a promotional campaign. COVID has really taught us about prevention. It's been a huge social experiment in preventing COVID. We've had to do these hard measures of distancing, and we understand now that prevention and all these measures do work if we do them. So I think also there's an emphasis on staying healthy so you don't get COVID. And I think also the emphasis is on helping marginalized or vulnerable populations. We've seen that we're only as healthy as our most vulnerable. So I think now is a time to sort of ride that wave of attention of staying healthy so that we can beat COVID, but we can beat anything. We can really be healthier in the future.
It's been a truly passion project for you. What have you learned through going through this whole experience?
I have learned so much. Working with computer science people, it's so interesting. And it's so fascinating to see what you can do. I was very fortunate to be introduced to this wonderful researcher, Helen Monkman, who's an assistant professor in health informatics in University of Victoria. And so she has taught me a lot about e-health literacy. So how to present the page of information so that people who are not especially health literate, like a lot of patients I had who were new Canadians, how do you present, without presenting a wall of information that us doctors are used to, present little bites and then give them more afterwards. So that's been a big learning experience for me.
The knowledge translation is a huge element here. And part of that is that it's not just doctors who are providing the information, that there's actually a huge, patient and stakeholder and family component to this. So has it been awkward or, difficult to just ensure that you're always getting the best possible knowledge translation?
Yes, absolutely, because most of that expertise has been taught to me through this e-health informatics professor. And, it's really been just a small project up until now. It's just been me, computer science students, and talking to Helen Monkman once in a while. And, I haven't really had the resources, the time to go and meet with other groups and sort of explore what would be best for them. The study was really a revelation to see what patients thought and to get comments that were, super interesting. We had an app developer who said, yeah, this Canadian, and that's why it's important. It keeps changing. That's why you need an app, and that should be, front and center. So that's why we did the video because of his comments. So that's very helpful. I think your point about the vignettes is really important, and I've used them in teaching, but I think it would probably be good to put vignettes on the app so people could see how it's used. And I think the other thing is I really learned from other researchers at University of Ottawa about sort of socially marginalized populations and how, for instance, 211.ca is it's a website where you can find what is the closest food bank to you. If you enter food and your postal code, you can find housing information. So that's been a real eye-opener for me, and just networking with researchers and physicians who deal a lot with marginalized populations. I mean, I dealt with them as a inner city physician, but they've sort of made that their research interest. So that has been extremely helpful too.
Is the app accessible through the 211, Cleo?
No, but that's a really good point. Because apparently this researcher at Briere knows, I think, the CEO of 211. So that's a good idea. I could approach them.
And Cleo, knowing all the analytics of the app, what would you say are the top one or top three things that you've noticed that people are kind of flocking to on the app and digesting and taking in?
So up until now, I must say in the last 6 months, it's been COVID, and but all kinds of other things. Memory was very high on the list. So older people or younger people looking at, dementia, how to prevent dementia. So that was really interesting to us. And physical activity was a big one too. So I think we can really add more tools to those ones to make them more interesting, but also look at the other ones that aren't as popular and improve them.
Cleo, what are your goals for the app right now?
First, things that are in the works right now are a transgender interface of the app. So I have a resident in family medicine from University of Ottawa working on this. They have to do a research project during the residency, and she's doing wonderful work looking at the guidelines and reviewing the literature. And we're working with the computer science people to make an interface that would be acceptable to transgender and non-binary people. we really would like to develop this further. So we're looking for maybe a permanent home and more resources, because I feel that we need to promote it across Canada, or start with the province, for instance, in Ontario, and then scale it up. And there's so much potential right now with, for instance, marginalized populations. We could co-design with stakeholder groups, with Indigenous associations, or with racialized minorities. And that's the way to go from all the things I've seen. And I totally understand that you really have to go to the community and co-design it with them. So we would need some help for that. And I guess the other thing, the potential for translating it into languages for new Canadians would be fantastic. I have a Arabic speaking resident who, is kind of interested in that too. So there's lots of things that I'd love to do with this app.
It's been great talking to you, Cleo, and just hearing about such a dynamic and, innovative approach to giving both, the public information, but also helping health providers access and educate their patients.
No, that's fantastic. And I like the fact that you're saying, because it's true, we often see things where it's like, are you a patient? Enter this portal, and are you a provider? Enter here. But sometimes some people may have that kind of fear of missing out. Like, oh, well, what's there? What am I missing?
Yeah, yeah, exactly.
To your point, I can see. I think that kind of breaking down of silos in healthcare is a bit, it's a bit different for people.
Yeah.
So people are like, oh, I'm not too sure about that, but I'm happier, and I'm sure as more people go and download the app and look at it, and more providers give you feedback and more patients give you feedback, you'll see what works best. And I can tell by the team you have around you that the agility you guys have, that you can totally make changes if necessary. But I like the fact that you have it as one.
Thank you.
I agree with that too, Philip. Yes, that it's, as you say, it's democratic. Like, why shouldn't patients be able to see what their providers are looking at? So,
and they're going to Google it anyways.
Yeah, exactly.
Why not have it for you all there? It's trusted information.
Exactly.
You don't have to go and then get home and be like, well, I wonder what my doctor was looking at.
Yeah. It's sort of been just a gut feeling for me that I want it to be very democratic and transparent. So I've kept the two there, that you can look at what your healthcare provider sees. If you want to go look at the study, that the background behind a recommendation and the scientific study behind it, you can do that. But if you're a healthcare professional, you can take the app out and show your patient the patient side, and you can go look for all kinds of resources for patients on the patient side. So I'm kind of glad we've stuck with the two interfaces on the same app.
Thank you so much, Cleo. We just love talking to you and really wish you all the best with icanbewell.
Thank you. You've made it very stress-free and very pleasant. And so thank you. And thank you for your, I appreciate the reflected support and enthusiasm. So yeah, thank you. It's very, very kind of you. I appreciate it.
You've been listening to Rebuilding Primary Care, a special series about family health teams produced by HIROC and the Association of Family Health Teams of Ontario. Today, our guest was Dr. Cleo Mavriplis, a family physician and professor with the Briere Academic Family Health Team at the University of Ottawa. She's also Assistant Dean of Faculty Development at the French Satellite Faculty of Medicine at McGill University. To access the app, go to icanbewell.ca. Stay tuned for more episodes of Rebuilding Primary Care.
Thank you for listening. You can hear more episodes of Healthcare Changemakers on our website, HIROC.com, and on your favorite podcasting apps. If you like what you hear, please rate us or post a review. Healthcare Changemakers is recorded by HIROC's Communications and Marketing Team and produced by Podfly Productions. Follow us on Twitter at HIROC Group or email us at communications@hiroc.com. We'd love to hear from you.